if you're watching this and listening to this right now, you should be really angry. I'm really angry listening to this. Again, I cannot believe that our FDA does not require each batch of generics coming from China and India to be independently tested. This is like mind-blowing to me, especially because Big Pharma and the news has been so salty and putting out so much scary propaganda about peptides and saying that, oh, these are Chinese peptides and they're sketchy and they're black market and you shouldn't purchase them. But the reality of the situation is a lot of these research peptides and research companies that are out there are doing tons of independent testing, and a lot of the product is like 99% pure. They won't sell it to the public unless it's 99% pure. So they have this campaign and this mission to eradicate Chinese peptides because it's bad, it's whatever. But these companies that they're trying to demonize literally go through so much more scrutiny to independently test what they're selling to Americans. And they don't even have to because it's not FDA regulated. And even the stuff that is FDA regulated, they tried to get rid of and demonize also under the Biden admin. They took a bunch of peptides, I believe it was 14 peptides that were on the Category 1 list, and put them illegally, this is according to RFK, they illegally put them on the Category 2 list. So people could no longer get them from a compound pharmacy. And they should have never been put on the Category 2 list because the Category 2 list means that there's a safety issue. And there was never any safety issues with these peptides. I don't know why that was done. Probably has to do with Big Pharma and lobbying. But people that use peptides are having pretty much miraculous transformations. And like I said, if you pay attention to the news and you're in the wellness community, you see this propaganda that they're trying to demonize peptides and trying to tell you that they're bad because they're from China, when, like I said, the reality is a lot of the reputable companies are going above and beyond to make sure that they're independently testing and the product is really pure. And we cannot say this about the generics that we're getting from our pharmacies. And a lot of these medications are being given to our senior population. There's a lot of seniors, people over 65 in America, that take a handful of 10 or 15 generic medications a day. And we have no idea what's in them. We have no idea what's in them. Gosh, no wonder so many people are dealing with dementia and memory problems. Who knows what they're actually taking in their prescriptions? And again, I'm just so blown away. I had no idea that they were not required to independently test all these meds coming from foreign countries.
Participate in these hearings on drug safety, supply chains, and risk to aging Americans. I am a physician scientist who studies mechanisms of aging-related chronic diseases, particularly those that damage the brain and cause insulin resistance, like diabetes, obesity, and dementia. My educational and academic backgrounds have equipped me to conduct such research, understand their societal impact, and experimentally demonstrate how the toxins' exposures cause chronic disease states that are currently epidemic and particularly afflict seniors. In contrast to messaging designed to pin these problems on genes, in fact, the decade-over-decade increases in chronic disease rates mirror the effects of exposures rather than aging or genetics per se. Well, what could possibly be the culprit? Convergent factors, including several of the testimonies highlighting significant quality concerns about generic medications manufactured in foreign countries, drew my attention to this committee. Prior to that, I had already begun to investigate the potential cause of several insulin-resistant diseases in a person I'll refer to as Sam. Sam was previously healthy, gainfully employed, and productive. His only medical problem was hypertension. However, after taking 2 years of a prescribed generic antihypertensive medication, Sam developed type 2 diabetes, obesity, muscle weakness, and metabolic problems. His symptoms worsened, his cell status progressively deteriorated, rendering him chronically ill and virtually incapable of caring for himself or his disabled child. Deep dives into Sam's new unexpected complex illnesses led to evidence that he had been chronically exposed to toxic levels of nitrosamines present in his prescribed antihypertensive medication. My expertise includes research and non-cancer causes of toxic effects of nitrosamines. We know that chronic low-dose exposures can cause insulin-resistant diseases, diabetes, obesity, dementia. Sam's blood work and eventually records released from the pharmacy confirmed that his nitrosamine exposures had occurred via contaminated lots of his medication. Sam, now debilitating chronic disease state, mirrors what we've observed in experimental models and in humans exposed to nitrosamines from various sources, including dietary and medicinal. How many people were exposed and developed these serious side effects, we don't know. Unfortunately, despite an FDA recall early in 2025, contaminated lots of the index medicine continue to be sold in the United States. Sam, unaware of the recall, took the medication as prescribed. Nitrosamine contamination of drugs is an old story in pharmaceutical industry, but the problem is managed or eliminated by standardized clean manufacturing protocols, extensive monitoring, end product testing, and quality control. Nitrosamine contamination is just one example of how lax regulatory oversight in generic drug manufacturing can have devastating effects on health. Problems concerning unsafe drug manufacturing disproportionately impact seniors, in part because they are victims of polypharmacy. More than 40% of Americans who are over 65 take 5 prescribed medications a day, and between 10% and 20% take 10 or more per day. Healthcare providers often prescribe additional drugs to combat the side effects of the targeted therapeutics. However, side effects from those drugs add even more prescriptions. Matters are worsened by many non-prescription generic medications used by seniors. More drugs mean increased risk for adverse events like toxin contamination exposure. Growing concerns about generic drugs originating in foreign countries, particularly China and India, and that were widely sold at attractive, possibly unrealistically low prices in the United States stem from unacceptable manufacturing conditions and lax oversight on quality, safety, and efficacy. These problems threaten the health and welfare of consumers, particularly seniors. Circling back to our extreme reliance on cheaper but concerning quality generics, the year-over-year soaring prevalence rates of chronic diseases, including diabetes and dementia, parallel the rate shifts in overseas poorly regulated generic drug manufacturing, coupled with polypharmacy. Sadly, this cascade is driven by financial gains, yet makes no sense to spend lavish amounts of money on so many medicines that make so many seniors sicker and sicker with chronic diseases. Thank you.
Every speaker that comes on, I'm learning so much that I wish I didn't have to learn about. And again, I'm just so blown away with what I'm learning in this hearing. It's very, very troubling. She literally just summarized what I said before. We're giving our seniors these medications. Some people are taking 5 meds, some 10, some 20. They have a side effect, and instead of thinking, maybe it's the medication, maybe we need to take them off this medication and do something else, change their diet, a supplement. Nope, we're going to give you another medication to counteract that side effect. And then that next medication gives you another side effect, and then you're prescribed another drug. And all of a sudden, you're popping 30 pills a day. And they have no idea what's in your medication. And what I think she was saying is the toxins in these generic meds, and we don't even know how many is in there because apparently our FDA does not require any independent testing, are actually causing all of these health conditions in people. And these people just think that they're doing what their doctor told them to do. They think that they're good patients. Their doctor prescribes them a med. They take it exactly as the doctor prescribes. And they trust their doctor to help them so they can live longer or have a better quality of life. And what's happening is the opposite effect. Their quality of life has been severely compromised. And I see this a lot, especially when I worked with seniors during like COVID. I think I shared in another stream. I worked in insurance, and during the COVID lockdowns, a lot of people over 50 wanted to get life insurance, final expense insurance. And I used to joke that after I got done writing an application, I had carpal tunnel syndrome from typing in, all the meds that these people were taking. But what she's saying is absolutely true. Our senior population is on a lot of meds, and I kind of feel silly. I didn't even think about that. I didn't even think that, maybe these meds that they're taking could be causing dementia, could be causing these issues. I really never thought about that, and that's really naive of me. And I'm sure some of you that are watching this have had this thought process that it could be causing it. But I really, truly believed that these companies were obligated to test the drugs before dispensing them. I had no idea that there's no oversight, no independent testing. I had no idea that this was a thing. And I'll tell you what, guys. I'm a third generation business owner. I am all about capitalism. I love capitalism. I love America. I think we are the greatest nation, and I want capitalism and free markets to continue. But we have gone a little bit too far with the greed aspect. We have allowed companies, and there's a lot of companies that are doing this, to basically sacrifice the safety and the quality of life of our citizens just to make some extra money. And that is wrong, and that should not be allowed. And what really is bothering me about this hearing, and I'm sure it's an unpopular opinion, but I am really displeased with the FDA. I don't even understand why the FDA exists at this point. The way that I see the FDA is that the FDA is supposed to be a government agency. We, as taxpayers, we're paying the FDA. We're paying the FDA to have oversight on the things that we put in our mouth, drugs, food. And the FDA's sole responsibility before they approve something is to make sure that it's safe for us to utilize. And how many times has the FDA got it wrong? How many times has the FDA approved something, said it was safe, and then a few years later, a bunch of people are dead. People are being born without limbs. People are getting massively addicted to a medication that was supposed to not cause addiction, that was supposed to be totally safe. You can just, give an Oxycontin to somebody with a migraine or a toothache, and don't worry, we got this study here that says that it's not addictive. Trust us. Don't do any oversight of your own, FDA. Just trust us. It's safe. And then there's no accountability from the FDA. Nobody from the FDA gets in trouble. You don't hear about an FDA employee getting in trouble for approving something that caused massive casualties. That's just my opinion. I'm sure a lot of people don't agree with me, but I think the FDA is a terrible government agency. They have failed so many times, and it's so aggravating that our tax money pays them to literally approve things and make sure that we're safe, and they are just failing. They fail so often.